Menstruation is the only blood that is not born from the violence, yet it is the one that disgusts you the most. Menstruation is a human mostly normal vaginal bleeding, often called the period. When a baby girl is born, her ovaries contain hundreds and thousands of eggs, which stay inactive until puberty begins. There is not one right age for a girl to get her period, but most girls get their first period about 2 years after their breasts start to develop, when they are between age 10 and 15. But it's different. Every girl's body has its own schedule. Two structures in the brain, the pituitary gland and the hypothalamus, produce complex hormones that stimulate the ovaries to make female sex hormones start and control the menstruation cycle, and it will continue to about age 51, usually lasting from 3 to 8 days. The menstruation cycle includes several phases. The first phase of the menstruation cycle begins on the first day of bleeding and lasts for about 14 days. The pituitary gland, located at the base of the brain, releases a hormone called FSH. These hormones cause one fluid-filled follicles contain a mature egg to the develop. The maturing follicles produce the hormones called estrogens, which increase over and peak in about day 12 and causes the lining of the uterus, endometrium, to become thicker and more enriched with blood vessels. In fact, the woman's body prepares to get pregnant. On about day 14, the high amount of LH and FSH causes the egg to be released from the follicles. The high level of LH also causes a brief surge in testosterone, which increases sex drive right at the most fertile time of the cycle. After releases, the egg enters the fallopian tube. Tiny hairs in the tube's lining help push it down the narrow passageway toward the uterus. If the sperm cell can successfully meet an egg cell in the fallopian tube, the fertilization will take place here. Once there, the egg is released. The follicle sills over, and this is called the corpus luteum. After the release of the egg, level of FSH and LH decreases. The corpus luteum produces progesterone. If the fertilization has occurred, the corpus luteum continues to produce progesterone, which prevents the endometrial lining from being set. If the egg is not fertilized, it disintegrated after about 24 hours. Then the corpus luteum also disintegrated, which causes progesterone level to drop and signal the endometrial lining to being shedding after about 14 days. The menstrual blood is partly blood and the partly tissue from inside the uterus. It passes out of the body through the vaginal. The period comes again every 24 to 38 days from the first day of the one period to the first day of the next. Beside bleeding from the vagina, you may have abdominal or pelvic cramping pain, lower back pain, headache, fatigue, mood swing and irritability, food craving, bloating and some breast aches. Thank you.